Well, it is being called one of the biggest breakthroughs in treating severe depression in years. One drug with a lot of promise. Dr. Richard Jackson is a physician, board-certified psychiatrist, and medical director of the Ketamine Center of East Tennessee. He joins us this morning with more on the treatment of depression with ketamine. And Dr. Jackson, good to have you back on Daytime.
Thanks, Amy. It's good to be here.
Well, we continue to read more and more positive results and responses when it comes to ketamine. And you were telling me there was an article recently posted on this as well.
Well, we got a nice article in the Johnson City Press, and we're thankful for that, mostly about ketamine. And ketamine is a drug that was developed more than 50 years ago for use as an anesthetic, and it's still used as an anesthetic in hospitals around the world. But for more than 10 years, it's been under really intensive study as a psychiatric drug because it's very effective.
And you've been using it here in Johnson City for several years now with a lot of positive results.
Right, for about 5 years. Older medications sometimes work for depression, and when they do, that's really great. But often they don't, or they have unacceptable side effects. And then medications for anxiety, for example, Xanax, can often be addictive and have other problems associated with them. So a lot of people have just given up on ever getting better and have been depressed for years, and ketamine offers some new hope.
What types of patients can be helped by ketamine? You mentioned severe depression. I understand PTSD it can help something like that.
It's effective for PTSD. It's been shown to be effective for obsessive compulsive disorder. It's effective for anxiety disorders and panic attacks.
Wow. And
so basically anybody that has a treatment-resistant depression that hasn't responded to the usual antidepressant medications can be treated with ketamine. In my practice, I treat mostly adults, but it can also be used with adolescents, and it can be used with children, although that's a little more unusual.
What does a treatment plan look like then for someone that comes into your office when you meet with them and do that consultation, and then they go through this type of treatment? What does that look like?
Well, the treatment is given by a nurse under my supervision, and it usually consists of injections that are given for about 40 minutes. The patient stays awake during the treatment. Some people like to talk during the treatment. Some people sit quietly. Some people listen to music. They can have a friend present if they want. They have some side effects during the treatment, but they go away quickly after the treatment. A few people have brought in a companion dog along with and that can be really reassuring. So the patients stay until they feel stable, then they're able to go home. They can't drive for the rest of the day. Most people will start to feel better within a few hours after the treatment. For some people, it takes several treatments before they see much of a response. We usually recommend a series of about 6 treatments. People don't respond forever, nothing's permanent, but maintenance treatments are available if necessary, usually on a much lower frequency of treatment.
What type of a response are you hearing from your patient? I mean, it has to be an amazing feeling to have them almost give up hope, like you said earlier in the interview, and then to finally find something that appears to be working.
Well, there are a lot of research studies, and they're showing 70 to 80% response rate, and that's consistent with our practice. I do some other things to try to make sure that people are getting the best possible response. I'll order lab studies on most people to try to look for any conditions that may be causing or worsening the depression or preventing from responding, and usually I can find a few things. I'll often order supplements and sometimes other medications to see if we can get the most out of it. Usually recommend psychotherapy if they're not already receiving that, and often changes in lifestyle like diet and weight management and sleep.
Wow. Sounds like it can make an incredible difference, though. Dr. Jackson, thank you so much for joining us. We'll give everybody the information. If you would like more information, you can visit that website right there. You can also call the number there on your screen.